Hello, I'm Sian Welby and welcome to the FamilyGP.com TV with me and Dr. Chris Steele. Now, we all know the problems of junk food, but it seems that we're also suffering from the effects of junk sleep. This is when our sleep is disrupted up to 90 times a night. In fact, a recent survey discovered that only 20% of us are getting a decent 8 hours sleep a night. And the leading cause of this was reported to be night cramps, with 80% suffering at some time with these pains. So firstly, Chris, what are night cramps?
Well, as the name suggests, they're crampy pains that occur in muscles during the night, in particular affecting the calf muscles. It's a sudden onset, painful spasm of your calf muscles, which actually can be quite distressing, this pain. And of course, it may occur once a night, it may occur several times a night, and even when the cramp is worn off, you might still have discomfort for 24 hours later.
So what causes the muscles to spasm at night time?
Well, I know that's a good question, because there's a lot of discussion about this. Some doctors say we don't really know the cause. We do know that cramp in muscles can result from dehydration. Sports people on marathons, in hot weather, they're becoming dehydrated, they're losing salts out of the body, and we know that those problems like dehydration, losing salts out of the bloodstream, can cause cramps. Poor circulation can cause cramps, and even just physical activity itself. I mean, we've probably all witnessed footballers getting cramp on a pitch, and one of the colleagues comes along and stretches the calf muscle by bending the foot up to alleviate the cramp. So many different causes, and sometimes there is no obvious single cause. Who
is more likely to be affected by night cramps?
Well, we know it's more common in the over 50s, more common in women than men. In fact, about 70% of the cases occur in the over 50 age group.
Now, luckily I don't, but if I did, what would I do if I suffered from night cramps?
Well, you can use a very old-fashioned treatment called quinine. We actually prescribe a product called quinine bisulfate. Now, quinine is actually present in tonic water, but at very low levels. It's also been used as an anti-malaria treatment in the past. Now, it's quite effective at treating night cramps. However, there are some problems. It can cause side effects like tinnitus, which is ringing in the ears. You've got to be careful if you've got a heart condition. You can't use quinine if you're pregnant or breastfeeding. So, there are some limitations there.
Now, Crampex is actually an alternative to quinine and is the only licensed medicine available without prescription to treat night cramps. So how is this different to quinine?
Well, totally different. It doesn't contain quinine at all. You can buy this over the counter. It's interesting because it contains calcium, and it's thought that many cases of nocturnal cramps in the calf muscles might be due to a low calcium level. It also contains vitamin D3, which aids in the absorption of calcium, and it also contains nicotinic acid, which is what's called a vasodilator. It improves the circulation. So you're getting the effect of these ingredients without any side effects and no interactions with the medicines. That's one thing I forgot to mention. Quinine can interact with other medications, and of course this doesn't.
Oh, great. So what can we do to actually try and prevent the cramps from happening in the first place?
Well, keep well hydrated. One cause of cramp is dehydration. People think of dehydration as, dry mouth and, severely dehydrated. You're dehydrating before you feel thirst in your mouth. So drink plenty of fluids through the day and before going to bed at night. Exercise regularly. Walking and swimming are nice forms of exercise that won't overstress your muscles, right? If you find that you've got cramp, what can you do to help yourself? Because maybe you've not taken any medication. A trick is to get out of bed and massage the leg, rub it quite firmly, and that may ease it, or applying heat might ease it. If you're very prone to cramp during winter months, using an electric blanket in the bed will keep your legs warm. But a well documented way of controlling cramp, when it starts, get out of bed, go over to the wall, right, put your hands against the wall and move back a little, keeping your heels on the ground so that your arms are outstretched, your heels are stretching out behind you, but the heels are on the floor. And what you're doing there is you're stretching the calf muscles by keeping your heels on the floor. And when you stretch the calf muscles, that eases the spasm.
Okay, thanks Chris. Now you can get more information about getting a good night's sleep at goodsleepadvice.com, and you can even request a free leaflet. Now you've been watching the FamilyGP.com TV with me, Sian Welby, and Dr. Chris Steele.